6 miscarriages is not a joke. This can lead to, as dreaded a disease as cervical cancer.
Why do we talk so little about menopause?
So periods happening in between the periods is definitely not normal. Good sleep is mandatory for every individual.
What symptoms could not be ignored at all?
Before the cervical cancer is diagnosed, there is at least 8 to 10 years to 15 years in the making of cervical cancer.
Yeah.
And sometimes, we may have to remove the uterus even before their conception as well. The condition becomes so severe that the woman tends to give up upon childbearing. Endometriosis is something which will make the tubes, the ovaries and the whole of pelvis totally abnormal, so that a natural conception becomes a little difficult.
How small can a fibroid begin?
So we have seen fibroids which are like 8 months, 9 months pregnant uterus size, and patients having absolutely no symptoms. The patient might require an open surgery, and open surgery that too, not just a horizontal incision. So don't be scared of any condition. There is a solution for each and everything.
Today we are thrilled to welcome Dr. Madhuri Vidyashankar, an advanced gynaecologic, laparoscopic and robotic surgeon affiliated with Motherhood Hospitals in Bengaluru. A pioneer in the field, she has co-authored a textbook on single-port laparoscopic surgeries and contributed key chapters on managing endometrioma, SILS, myomectomy, and hysteroscopy in infertility. As a renowned speaker and operative faculty at national and international conferences, Dr. Vidyashankar has performed over 14,000 gynecologic endoscopic surgeries. She also directs the RGUHS accredited fellowship in minimal invasive surgery at Motherhood Hospitals, Indranagar, with expertise in fertility-enhancing procedures, complex hysterectomies, and placenta accreta spectrum disorder. I'm so glad to have Dr. Madhuri Vidyashankar on our Women's Day special podcast. Thank you so much, Doctor, for coming over here and taking out time out of your busy schedule. And I'm expecting a great conversation here. Thank you so much for coming.
Thank you, Shruti. Thank you for having me here.
Doctor, I have a question, okay, because when I talk about myself or any women in general who are doing like regular activities, exercise, having food habits also not like way bad. It's like good food habits and eating proteins right, calcium right, all the supplements, vitamins, everything. And we do not see any symptoms that way, like since we're being very active. So if I look at myself, I think I have not checked myself from since quite a long. I mean, I do yearly health checkups usually once in a year. But like the tests, so many tests are there to check your gynec health, right? So what is the bare minimum you say that we must have it included so that we can keep our health right?
Yes. So now that you're saying you are regular with your diet, with your exercise,
yeah.
And I presume that you are aware how to manage your stress as well.
Yes.
I think these three are very important things: diet, exercise, stress, and sleep. I think if you are right with your sleep as well, you should not have any kind of issues to a great extent. In spite of all these things being normal, you should be doing certain health examinations, which you have been doing. But to those women who are not doing it, what I can emphasize is a yearly breast examination, abdominopelvic examination, a pap smear, and the history that the gynecologist takes about her menstrual period, about the intercourse, about the breast symptoms. All these things are very important for a woman. Now, why these things are important? So we make sure that we are screening for certain cancers at different age groups. Reproductive age group women, we are trying to rule out cervical cancers. Even before it can happen, we can pick them up around 7 to 8 years, 10 years, 15 years early. We're trying to pick them up. Breast issues we are trying to pick up. Uterine issues we are trying to pick up. So by doing this regular general examinations for women, we are trying to pick up those conditions where we can treat them much early in a smaller way. Not in a big surgical way, but treat it in a easier way.
Okay. So like when we talk about habits like sleeping pattern, like lifestyles, it's pretty different these days, right? With work. Some also have kids, family to manage. So when you talk about all this, so is the real issue is like unhealthy lifestyle or unhealthy habits or the delayed diagnosis?
Yes, as I said, women have been putting up their best. to do everything. And they do it to say a point when they have their children. Now, once they give birth to children, a child, it becomes very difficult for them to manage their
own health.
Yes, their own health. That takes that becomes the last priority for them.
Very true.
So this is when they tend to have a lot of problems. They will cater to the kids' requirements, to the husbands, to the in-laws, to the career, everything. But their health will take a backseat.
Right.
This is where we have to focus. We have to create awareness that they have to be taking out a little bit of time for themselves and doing it. So here again, it should become a habit to be going through a test so that it doesn't become a delayed diagnosis.
How often they should do this check?
They have to go yearly once. Yearly once. And when they go for a regular gynae checkup yearly once, most of the things will be covered in that.
Get it. So if a woman cannot fix her routine immediately, what is one non-negotiable for her in gynec health?
So what as doctors we can say is, if you are not able to do exercise or keep your lifestyle in check, at least go for a health checkup at regular intervals. At least yearly health checkup. Gift yourself, whenever there is an opportunity like your birthday or your anniversary, gift yourself a health checkup. That will go a long way in diagnosing most of the things.
That was a very, very important point you said. So what are the top symptoms of women dismissed as normal? How often do you hear that, I thought it was normal? Must be hearing a lot.
Yes. So see, pain during periods is completely normalized. And for us women, it has always been told that pain during periods is, yes, you must have it.
हाँ, period है तो pain होगा ही.
है ना? तो क्या होता है? छोटे बच्चे जब से पीरियड स्टार्ट होता है, उसी टाइम से अगर पेन है तो ये बिल्कुल नॉर्मल है.
Yeah, true.
So we will not know when an actual problem happens, like a fibroid starts growing or an endometriosis happens. It actually presents with pain. It may be an altered kind of pain. So this altered kind of pain, people will make it as normal. So it's very important to know what is normal pain and what is abnormal pain.
Right. So the next question which is related to that. What does heavy bleeding or ignoring pain may lead to?
See, heavy bleeding and pain can be symptoms that is related to fibroids. It can be related to endometriosis. It can be related to adenomyosis. And it can be related to, say, pelvic inflammatory disease as well. So many of our gynec conditions which are presented in women, they have the symptoms as heavy menstrual bleeding or pain during the periods. So these two are very, very important. And that's why I say women have to know what is normal, what is not normal. Maybe if I can just elaborate about that.
Yeah,
See,
sure.
normal periods means it will be there for, say, around 3 days to 5 days.
Right.
It can go up to, say, 5-6 days also. Anything less than 2 days or more than 7 days, we take it as abnormal. That is the flow.
Okay.
Pain happening on the first day of the periods for a few hours is normal. Anything beyond this is not. Women should not have clots during the periods. Okay, any kind of clots, small clots, big clots is definitely not normal. What that says is that the bleeding is quite heavy. So these two things, if the women know that what is heavy bleeding and what is pain. Now again, what is abnormal pain? Pain starting few days earlier than the periods. Periods pain persisting throughout the periods, or pain persisting even after the periods. So we call this triple dysmenorrhea, the patients having pain before, during and after. So there are conditions like adenomyosis and endometriosis which can present with triple dysmenorrhea.
All right.
So this is absolutely abnormal. So any women who are facing this kind of period pain, which is not restricted only to the first day, is definitely abnormal, and they should take a consultation with a gynecologist. And also when women face clots in their periods, prolonged duration of periods, or they feel that they need to change their pads very frequently, or get up in the night and change the pads, yes, these are all abnormal, and you have to take a consultation for abnormal bleeding and for the pain.
So, doctor, I have seen cases where, as I was mentioning earlier as well, that women feel so shy or still feels a taboo to break their situations or talk about, if any issues are persisting regarding to the period spotting or before or post coitus happens with the partner, I think they don't talk about it, and this may or may not lead to bigger issues later. So what happens, what is the cost of waiting if they don't come on time? Because there has been cases in few of the family members I've heard, and in friends also, they had some issues and they thought, okay, it's ignorable, like we usually get some cold at home or some stomach pain, right? We eat up some medicine and we think that it will go off, but later we keep ignoring it like this, and then later it becomes a bigger problem, and by the time we reach to doctor, it's pretty late.
Yes.
So what can you just let the viewers know that what could be the bigger cost of waiting like this and not talking about it to the doctor or gynecologist?
Correct. So you mentioned about postcoital bleeding.
Yeah, correct.
So that means after the coitus or after intimacy, if at all there is any kind of bleeding, that is absolutely not normal. But many women, as you said, they are shy. They do not want to discuss this with anyone. They just keep ignoring it, or they may rather defer their intimacy as well because they're having this problem. But this can lead to, as dreaded a disease as cervical cancer. Okay, so it may cost her life itself. So if she doesn't go visit the doctor, it may even take her life. Just like this, if regular examinations are not done with the breast also, sometimes women, they notice that they have a small lump in their breast. This is very, very common, breast lump. Women have noticed, and they think that it is because before the menstruation, they usually have breast pain. They usually have, heaviness in their breast and lumpy-like feeling. And also the kind of examination that they do on themselves may be a wrong examination. They feel that everything is good and they ignore. And it goes to such an extent that the cancer becomes an advanced cancer. Only then they present to the doctors.
Yeah.
So the cervical cancer, breast cancer are very, very common. They could have presented early. They will be having symptoms, but they never present to doctors. So it can cost their life itself when they present late.
Yeah, and I remember one of my friend in school days, whenever she used to get her period, she used to get hospitalized because of the pain. She used to take leaves from school and she used to be there for 3-4 days. I don't know what has happened later because I'm not in touch, but I'm not able to understand also what it can lead to if people are ignoring these issues.
These are the issues where, these days we are seeing as adolescent endometriosis and large fibroids in reproductive age group women, because somewhere they thought that the things are normal.
Normal, right.
Okay. And somewhere they thought that this will be fine later on. But when they came to the doctor, it was perhaps a little late.
Yeah. So we must stop normalizing these things, right?
See, for any condition, like say a fibroid, which can be treated with just observation over time, like say yearly one scan, may require a surgery if you're diagnosing it very late. So it can start from say 1 centimeter and it can go on up to 20 centimeters as well.
Okay.
And in between, the time that is required to diagnose this could be years. Okay, so if you are on follow-up, we know when what is to be done. So always early diagnosis is the best thing that you can do. So be on regular follow-ups.
All right. So what changes medically between 6 months delay or versus 3 years of delay?
As I said again, if a fibroid could be tackled just with medicines, or if a fibroid could be tackled with just a laparoscopic surgery, you delay it by say 3 years, 4 years, 5 years, the patient might require an open surgery, and open surgery that too, not just a horizontal incision, a big vertical incision might be required, which could go beyond the umbilicus. And this is the price that they pay for delaying the diagnosis. Okay. So we have many patients, especially because they don't tend to have symptoms always. They can be asymptomatic. Okay. And especially asymptomatic are the ones which present with huge masses. You will not believe they'll present with masses as huge as 8-9 months pregnancy uterus, 9 months pregnancy uterus size.
That's scary.
So that's huge.
I know.
And we see young women, gym-going women, because they have good tone in their abdominal walls, they will not even realize that they have huge masses.
Correct.
So this is what makes the difference. Early diagnosis, simpler treatment. Later diagnosis, you may have to go for a bigger surgery.
So doctor, have you seen cases where a medication could have helped if the patient have come earlier?
Absolutely. We see many cases day in and day out. I can probably give you, say, 3 examples. One is what we call as endometrial hyperplasia. Normally, we see this in the perimenopausal age group. When I say perimenopausal, it's the age between 40 to 45, around this age group.
Okay.
So when women still have excessive bleeding around this age, and somehow they are treated and, they go into their menopause at around, say, 48, 49, 50. But after menopause, they again start having their periods, which is absolutely abnormal.
Right.
Even one spotting after menopause is not normal. So when we go and investigate this woman, she would have had endometrial cancer. So
my
a
God.
problem which was there in the perimenopause, perhaps ignored, goes into the menopause and becomes an endometrial cancer. So a cancer could have been picked up in the early age and treated just with medications. Likewise, cervical cancer, before the cervical cancer is diagnosed, there is at least 8 to 10 years to 15 years in the making of cervical cancer. So it is this time that we can utilize, especially when we do a pap smear, we get to know about it. And now much earlier, that is the prevention of cervical cancer by way of HPV vaccines, which has been rolled out by the government as well. So there is lots of opportunity for us to pick up the cases from going bad much early.
That's very true. I think this will give awareness to the audience, of course. So I have another question for you that since you were talking about fibroids, right? So how small can a fibroid begin and how serious it can be later?
The fibroid we can see as small as, say, 0.5 centimeters.
Okay.
When we routinely do scans, we see many times 0.5 centimeters. There are 8 millimeter, 10 millimeter. And sometimes asymptomatic, it can be as big as 20 centimeters also. So we have seen fibroids which are like 8 months, 9 months pregnant uterus size and patients having absolutely no symptoms. So it's very, very weird that such huge masses, they are not experiencing any kind of pain.
So how much time it took for her to realize that she has...
They may have taken years together.
Oh my God, that's...
Okay, so imagine the kind of time that they have taken to go to a doctor. Years they have not been to doctors. They don't have symptoms. So here is what is very important, that yearly health checkups that matters.
Okay.
So fibroid, had this been picked up at a much smaller size, it would have been done with a smaller surgery.
So is there any regular test which women can include in their daily health checkup?
Yes, absolutely. So I think what I can say for all women is, immaterial of your age, yearly one health checkup, and that health checkup should include an abdominopelvic scan,
Okay.
a breast examination, and a pap smear once you're sexually active.
Okay.
So these minimal 3 tests will help you diagnose most of the gynecological problems that women face.
Doctor, I heard a lot of my friends that they were talking about they are going for surgeries to conceive or to help them to have a conception. Is it really true that surgeries can help to have a child or a baby?
Yeah, so it's something like this. A woman who is able to conceive naturally, yes, they don't require any kind of surgeries. But
Okay.
those women who seek the help of a gynecologist to conceive, normally many tests are done. They go through the tests, some scans are done. If they are able to conceive with regular small medications, yes, so be it. But there are certain subset of women who, in spite of giving medications, they may not be able to conceive. And there are a subset of women where there are certain conditions like fibroids, endometriosis, tubal blocks, some polyps inside the uterus. These are all conditions where we cannot give medicine and correct it. So these are the conditions which could perhaps be corrected with a surgery, minimal invasive surgery, either a hysteroscopic surgery or a laparoscopic surgery. And these are called fertility-enhancing laparoscopic surgeries. So whereby a person has everything great, but there is a little problem inside, which we correct by using a surgery. So probably it is these surgeries that your friends were mentioning,
Okay.
and this will help them conceive.
So
Not that by doing a surgery, we are bringing out the baby. It's not like that. But by doing these corrective surgeries, they are definitely able to conceive.
So it helps to remove all the hindrance to get the fertility.
Absolutely.
There, right? Okay.
Yes. Especially we see this in women of reproductive age groups. They are trying, but something is not happening. So when they come to us, when we do pelvic scans, we note that the women have fibroids, and these fibroids are usually projecting into the uterus. So whenever there are fibroids which project into the cavity, they prevent the pregnancy from happening.
So how long they should wait and then go for the tests?
No, whenever the fibroids are within the cavity, there's no way they have to go for a removal of that surgery if they want to, removal of that fibroid if they want to conceive. Okay, this is one thing. Then there can be something called as septum. So because you're asking about physical barriers, septum is something like a band inside the uterus, which will be dividing the uterus into two. So this again hampers the pregnancy from happening.
Okay.
And there are conditions called as endometriosis. I think this being the endometriosis month as well, I think we need to speak more about it. Right. And endometriosis is something which will make the tubes, the ovaries and the whole of pelvis totally abnormal, so that a natural conception becomes a little difficult. So many physical impediments which can lead to infertility.
So I have a question that cyst or fibroids are these same or it's...
No. See, cysts are something that happens within the ovary, and it is a watery kind of material that is there within the ovaries.
Okay.
Now, what are ovaries? See, what a female pelvis has, female genital organs, I can say, that is inside the tummy. It's the uterus. Uterus has an entrance which we call as the cervix, 2 fallopian tubes and 2 ovaries. Correct. That's it. Yeah. All that a woman has is these, along with an vagina. Okay, so these ovaries are the ones from where the eggs are getting released every month.
Right.
These eggs are required for pregnancy to happen, and also these eggs are important for the hormonal changes that has to take place in the body, and these hormones are required for taking care of the bones, the breast, the heart, the hair, skin, and all the glow. Right. So ovaries are very important for most of the functions that women need, as well as for conception. Okay, so the cysts are nothing but water-filled balloon-like thing within the ovary. Okay. Whereas fibroids are hard balls. They are just like balls which are arising from the uterus, from the wall of the uterus.
All right. Okay. So for a woman struggling to conceive, in what situation can fertility-enhancing laparoscopic surgery genuinely improve the chances?
Yeah. See, first we need to identify what are the conditions that a woman is having, so that is causing infertility. Correct. Now, normally, as I said, it can be septate uterus, it can be the endometriosis, it can be ovarian cysts, it can be tubal problems, or it can even be fibroids. Okay. So there is minimally invasive surgery for every condition that can lead to infertility. So most of these conditions we normally deal with laparoscopically or hysteroscopically. So these are two different things. Hysteroscopic surgery is what we do from the vagina. We place a camera inside the uterus, see what problems are there, like small polyps. Correct. There's a small fibroid inside the uterus. Okay, the tubes are blocked. So we do all these corrections from inside the uterus. And laparoscopically, that is, we go from the tummy side and we see if there is a fibroid, that is removed. The tubes are abnormal, they are treated. And there are cysts, yes, they are treated. So most of the conditions now we are able to treat either by a hysteroscopy or laparoscopy, and these are all minimally invasive procedures.
So medicine can help or not? I mean, for these, or has to go
No, these are all structural problems which cannot be dealt with only medicines. Okay. They will require some kind of surgical interventions.
So we know what tubectomy is, but what is exactly hysterectomy? Because I think viewers would like to know more about these two terminologies or surgeries we have.
Correct. So we very often use this terminology, tubectomy, thinking that everybody will know about it. Yeah. But about hysterectomy also, about tubectomy also.
Yes.
We just generalize it, thinking everybody knows it. But tubectomy means it's a family planning procedure done for the females, wherein we will take out a part of the fallopian tube. We tie a part of the fallopian tube. There are different methods, of course, by which the female will not be able to conceive after that procedure. So this is called tubectomy. So it's basically a family planning procedure.
All right.
And hysterectomy is total removal of the uterus itself. So uterus, cervix and the fallopian tubes, all three are removed by way of either open surgery, laparoscopic surgery or a robotic surgery. After this, the woman will not be able to have regular menses. And it goes without saying that she cannot have a child also.
Okay, which is recommended?
See, these two are totally different things. We do family planning operation or the tubectomy once the woman has completed her family.
Okay.
What I mean by completed her family is if the couple intend to have 2 children, they've had their 2 children, or a couple intends to have 3 children, they have had 3 children, they do
Okay.
not want any more children, then they will go with this procedure, tubectomy.
Okay.
Whereas hysterectomy is done when a major problem is there in the uterus, which has a fibroid or inner lining of the uterus is abnormal where she bleeds torrentially, or there is a large ovarian cyst with a problem in the lining of the uterus as well. It is these cases that we remove the uterus.
Okay.
And uterus removal is normally not done till their conception is over. That is,
Okay.
till their childbearing is over in most of the cases.
I get it. Yeah.
You get it,
Okay,
right? So
yeah.
tubectomy is only a family planning procedure. Uterus is totally removed in a hysterectomy procedure.
When does hysterectomy truly become the right decision? Is it still a last resort?
Yes. See, when we think of doing hysterectomy is a radical procedure. What we mean by hysterectomy is removing the uterus and the cervix. Okay. As I said, the uterus is the place where the baby grows, and that is where it grows up to 9 months.
Okay.
And the entrance to this part is called as the cervix.
Okay.
Okay. So removal of this uterus is called as the hysterectomy procedure. Okay. And hysterectomy procedure, we do it in various methods. Yes, that's a different thing. But when do we really get on to removing this uterus? So as I said, it's a last resort. There are many minimally invasive surgeries that can be done to keep these uteri without having to remove them. So there are some conditions where we really can't do anything. We have to remove.
So after
Like-
that, I think women cannot conceive, right? If that is removed.
Yes. So it is usually done at a phase when women have already conceived.
Okay.
Okay. Usually we do it only around the perimenopausal age group
Perimenopause,
or
okay,
in
got
the menopausal age group.
Okay, so I've seen cases where earlier intervention could have avoided it.
Absolutely. So we have been able to avoid a lot of hysterectomies. You know, as I said, one is early diagnosis. Women come early with excessive bleeding. We see that there is endometrial hyperplasia, or they see that there are small fibroids, polyps. So we remove most of them through hysteroscopic procedures. And also there is something called as intrauterine device, which will be releasing the medicine, which is progesterone. Now these devices, we are able to place it inside the uterus, what we call as Mirena insertion, and we have been able to avoid lots of hysterectomies which have been done mainly for excessive bleeding. When the uterus did not really have any problem, but she had excessive bleeding, yes, we avoid most of these surgeries by inserting these devices. And now there are certain medications as well, by giving which, you know, the necessity of hysterectomy can be reduced in a particular subset of women, not all women. In a particular subset of women, we can definitely avoid hysterectomies. But see, when they present very late and we have no other option, yes, we have to go for removal of the uterus.
So that creates issues later, or like any post
Yes.
symptoms.
So we take them as individuals. We cannot give a blanket therapy to everybody. So we take every individual, see what is her requirement. If she needs fertility, there is no way we are going to do a removal of uterus.
Okay.
So it will be a fertility enhancing surgery for her.
Okay.
So in these cases, we will not think about the route of surgery, that we have to give a laparoscopic surgery. No, it is not going to be that. It will be our it's a requirement that uterus has to stay. Any route of surgery, we will keep her uterus.
All right. With minimally invasive techniques today, what does hysterectomy actually involve?
See, hysterectomy is, as I said, removal of the uterus with the cervix and with the fallopian tubes. So whether we remove the ovary or not, it depends on the patient parameters. Okay. We are able to do hysterectomies through vaginal route. We are able to do it through laparoscopic route. We are able to do it through robotic surgeries as well.
Oh, that's
So the open surgeries which were done earlier, that is by cutting open the abdominal wall, has come down greatly. So
then she's
now-
pretty small these days,
yes,
right?
yes, very tiny incisions. So we've been able to do it with most of the cases with laparoscopy or robotic surgeries.
So the healing takes time for the incision?
Yes, if it is done as an open surgery, it takes a lot of time. But when we do it through laparoscopy or laparoscopic route, the recovery for a surgery like hysterectomy can be as less as 1 week to 10 days at the most.
So as you mentioned that hysterectomy is done on older age groups, right? So, but I have heard that even in younger age group also hysterectomy is done. So, what is your take on this, and like why is it getting done at so younger age?
Yes, see, there is a condition called as endometriosis, and this severe endometriosis, when it affects from a very young age, like say adolescent ages, also there can be endometriosis. Normally we are managing them through the years. They've had their children, and finally when it becomes totally unbearable to manage this endometriosis, these younger girls also can undergo hysterectomy, say around 30, 35.
Okay.
Even before their 40 years, they might require, and these are usually conditions like severe endometriosis, severe adenomyosis. They can cause such severe pain, such discomfort for the young girls or say in their reproductive age groups.
Okay.
So if they complete their family early, yes, they could still go with removal of the uterus, to live their life normally.
Yeah.
And sometimes, we may have to remove the uterus even before their conception as well. The condition becomes so severe that the woman tends to give up upon childbearing and go with pain relief for removal of the uterus.
So these will be symptomatic ones.
They will be very, very symptomatic. It will be distressing to them. They will not be able to go with their normal lives. That is when we tend to remove them.
Okay.
Now, especially with endometriosis and adenomyosis being rampant, we see many of these girls undergoing surgery. See, adolescents, again, what happens is, the pain is normalized for all of us. They have seen mothers having pain during their periods, okay, and listening to grannies saying that they had pain during their periods. So
right.
it becomes an absolutely normal thing for everybody. Sometimes the kids will have to miss their school, even that is normalized, maybe during periods. Yes, that is what used to happen. So this normalization of an abnormal thing leads to missing out the diagnosis. And endometriosis is not far away from that. And especially when it is an adolescent girl, it will be the last thing that will come to our minds that she will have some kind of a problem.
So I mean, at that age also you can develop these
absolutely. See, this is what, just like you, many women, even the elderly, will not be aware that there can be endometriosis even in younger kids.
Yeah.
So what we see now is even school-going kids can have endometriosis. So this adolescent endometriosis, we can only create awareness.
Yeah, and I think this podcast would definitely help them to, get the awareness on this.
Yes.
So if you talk about like early diagnosis, right? So how early can endometriosis present in adolescents, as I was asking you already? And what sign should parents watch for?
Yes. So basically, as I said, awareness. Now the parents must be aware that the pain, what is normal pain, what is abnormal pain. And as I said that, I reiterate it again, that the pain that starts few days before the periods or even 1 to 2 days before the onset of the proper flow is not normal. The periods pain should stop on the same day of the menstrual bleeding. If it is not stopping, it is continuing through the periods, it is definitely not normal. And having pain in between the periods is also not normal. Having pain after the periods is also not normal.
What about not having pain?
Not having pain is absolutely normal.
Okay.
Okay, so
Right.
it's, these kids are blessed, I can say.
Oh, okay. All right. So, like stress is very normal these days. So that could be like one of the contributing reason. But how do stress, poor sleep, diet, smoking, and alcohol can, worsen the inflammation?
Absolutely. See, the main point at endometriosis, why endometriosis happens is this inflammation. Okay, there are lots of changes happening in the body. And see, if I can take a woman who is genetically predisposed to develop endometriosis, her genes, when they are exposed to certain factors in the environment, what we call this as epigenetics. That means you already have some issue in your genes, but these genes, when they are exposed to nature or the environment, which will give it more damage, which will damage it more.
Okay.
So these are the environmental factors, as you mentioned, the stress, alcohol,
Smoking.
smoking.
Yeah,
All
and
these can make those abnormalities in the genes, and it will enhance, or it will make sure that you come up with this disease at an earlier date.
yeah, so lifestyle these days are pretty, tough to manage everything, house, work, and everything. Sleep
Yes.
pattern also gets abrupt every day, right? So I think that is like one of the reason I think these issues are getting.
Yes.
Women are suffering from these issues.
So
I
we
think.
have to emphasize about having a healthy dietary habits, having good sleep. I think we cannot overemphasize this. Good sleep is mandatory for every individual. You must take out that minimal required 6 to 7 hours of sleep somehow. So that will repair most of the things.
That's right.
Healthy diet, sleep, and good exercise.
So, doctor, I think there are so many women which are not much talking on, perimenopause or menopause, and I think with different lifestyle changing these days, the age bracket also I think has shifted a little before then, like what we say on books, right? Like if 40 plus women might have menopause, but I think the age has shifted a little bit prior. Like if we got talk about periods also, earlier girls used to get periods later after 13. Now I have heard like girls of age 11 also are getting periods. So like
Yes.
how do we talk about premenopause, the age bracket especially? Like,
Correct. So what you said is right. I mean, more or less, it has preponed. The
correct.
age of menopause has preponed in many, and for some, it has postponed also.
Postponed also, yeah,
Okay, so
correct.
what earlier we used to say that 48 to 50, 51 is normal for Indian women. It has
Right.
come down in many of our women. It can happen even by around 40, 42 years also.
Very
And
true.
some women are still continuing to bleed even at 50, 55, 56 as well. Just recent last one what we saw, 56 years, she is not still stopping to bleed.
Yeah, and I think one of the news also came that one lady got pregnant at the age of 52 or 53. That was
Yes.
pretty surprising. I mean, so committing to like saying that, okay, this is the age bracket where the women should go, I mean,
Yes.
should get a pre-menopause or menopause. I think that is something very debatable,
True,
but I
true,
think you
true.
can put some light to it.
Yeah, true. So even though there are lots of variations in these kind of age groups, but
Right.
still more or less what we can say is around 42 to 48 is the premenopausal age group. Okay, that means it's the routine 6 to 7 years before the
Before.
menopause. And menopause hits normally between 48 to 50 to 53 in India. There
Okay.
are aberrations, of course. Some people come later and some people come early. But this is what the overall age is.
So that also get impacted due to some your lifestyle choices, your food
Yes,
habits, or like
yes, yes,
stress and
yes.
all.
See, we are having lesser number of kids, and we are exposed to so many environmental toxins.
Correct.
And, lot of these issues, the exercise and what we eat, perhaps we don't know how the mobile phones, the televisions, all these take us to. Okay, so there are a lot of factors that we are facing than what our mothers or, grandmothers faced. So we are bound to have differences in our age of menopause.
So there could be a lot of symptoms to premenopause or menopause. So what symptoms could not be ignored at all?
Yes, so when we talk about perimenopause, that is the age group between around 40 to 48 years of age. So these women can face excessive bleeding, what we call heavy menstrual bleeding. And as I said, dysmenorrhea again, that is pain during the periods, intermenstrual bleeding. Okay, so these are major issues, and there can also be lumps in the breast. Now, if I can go out of the pelvis and if I can talk about the breast, yes, the breast lumps are also an important factors around this age group. So
Okay.
whenever women have clots, bleeding more than 7 days, and happening again and again, less than 21 days, they get their periods back.
Okay.
These are all abnormal things. You should report to your doctors. Pain, what I said, triple dysmenorrhea. You face triple dysmenorrhea, you're not able to do your daily work, and pain is coming in the way. Yes, it's not normal. And whenever you have intercourse and you see bleeding or spotting, again, it is not normal. So periods happening in between the periods is definitely not normal.
So you are saying that as soon as you are about to get menopause, yani like 7 years before or 6, 7 years before that, so this keeps on happening on and off like for 7 years.
Yes.
Oh, that's terrible.
It is not only this, they can even have what we call as hot flashes, night sweats, this brain fogginess. All these can happen easily 2 to 7 years before menopause. So, what I have to tell here is even the family, the husband, the kids, they must be aware of these conditions, that what their mom faces or what their wives face,
Yeah, yeah.
it can happen many years before they actually have menopause as well.
Yeah, because there's a lot of mood swings happens, right? During
Yes.
if somebody is facing something like this, of course, like mood takes a side.
See, our women, what I can say is women are very, very tolerant. They are able
Very
to
true.
multitask. They are able to do so many things at a time. So, they try to forget about what problems they have and they normalize it and then they move forward.
And that is why, sometimes, women ignore such problems.
Absolutely.
Although they had it, but they were like, okay, we'll get checked it later, and then it becomes accumulated and
Yes.
turns into a bigger problem, right? So, like, since we're talking about menopause and symptoms like that, why do we talk so little about menopause? I have like no idea.
Yes. See, again, what I can say is it's normalized.
Yeah.
Everybody has to go through menopause. Everybody will have night sweats. Everybody will have hot flashes. And everybody will have mood swings.
Correct.
But this is not normal. The woman is secretly suffering this. So an awareness has to be created among the family, among everyone who is there around the woman, to know that these are not abnormal, and you have to give her that little space and that little encouragement that she should come out of that. And when women are encouraged to speak more about it, and
Yeah.
now they are able to hear many podcasts, hear many, see many reels, and the educational matter is also definitely way too more compared to the earlier generations. So they know now what is normal, what is not normal. They should speak to their friends, their colleagues, and they can directly meet the gynecologists. The information that they can get from their colleagues or the friends may not always be correct.
They're
And
very true.
internet may again, the Google may not always be correct,
Yeah,
appropriate
yeah,
for
yeah.
you. So it is best to go to your gynecologist and know what happens.
I think this is still a taboo that we talk about. Maybe periods, menopause, premenopause. I think that actually takes a seat back when women have to talk about it to
Yes.
anybody, like especially men. I think
Correct.
they hardly talk about all this, and I feel sad that during this phase of my mom when she got her menopause, I'm not sure whether what symptoms she was having or maybe mood swings. We always used to like ignore. Okay, she must be like little cranky, but that could be one of the reason. Like as you mentioned, that premenopause has so much of symptoms before coming, right?
Absolutely. So, because of more awareness, the people are getting to know that they have some issues and they seek medical care early now. There are
Right.
hormones which can give them the best of treatment, and they will be going out of these symptoms as well. So,
Right.
this awareness is what is important. They should talk out and they should be able to come out with their problems.
I think with
And as you said, it's a taboo.
yeah,
But I think it's no more a taboo, They
It should not
discuss.
be.
Now they have lots of avenues to discuss.
correct.
And even the gynecologists are freely, it's easily available for them now.
Yeah.
If not direct consultation, they can even take online consultations.
there are.
So it's never difficult to have a consultation now.
Yeah,
I
yeah,
think
right.
they should get the right appropriate informations.
Very true. And also with advancement in technology and modern surgery, I think things are possible these days to also diagnose and give a right resolution to it. So talking about that, has imaging and advancement in radiology has improved the early detection?
Absolutely.
Okay.
Yes. See, what we suggest for screening for women is a mammography for all women after the age of 45, and pap smears, or a sonomammography for breast, is either a mammography or a sonomammography, pap smears for cervical cancer, and abdominopelvic scans for uterine cancer or ovarian cancer. So all these are the ultrasound, the pap smear, liquid-based cytology. All these have evolved so much that it's become very, very easy now to pick up the most dreaded of the diseases much in advance.
So
And-
these can be included as part of like daily yearly routine checkups
Yes, absolutely.
without having the symptoms or diagnosis.
Yes,
We should have
that
it
is
involved.
what I think we should highlight now, that any woman after 45 years, they have to go through a routine health checkup, which will encompass these 4-5 things. That is breast examination, abdominopelvic examination, a pap smear, and few blood tests.
So, doctor, like since we are talking about technology and modern surgery enhancements, there are a few patients which might have some issues. And giving an example of one of my friend who is my neighbor, she's not able to carry the pregnancy for like more than 4 or 5 months, and I think she faces almost she faces her sixth miscarriage. So, I mean, since we talk about enhancements and modern technology, how
Yes.
is it not helping?
We see many of these patients and we get many referrals for this kind of surgeries. So what we have been doing for this condition is something called as tack stitch, TSC tack stitch. In this, we place a stitch at the entrance to the mouth through laparoscopically.
Okay.
That is, whether a patient is pregnant or non-pregnant, but who has a history of multiple miscarriages like this. Patient may have had 2, 3 or 4 miscarriages in the middle trimester. That is somewhere around 4th month, 5th month or 6th month. This is a separate category of patients. They keep having this miscarriage around this mid-trimester. And it can be so annoying to the patients.
I know.
6 miscarriages is not a joke. You
Yeah.
imagine what mental, the harassment that she would have undergone herself.
Exactly.
Isn't it? So we definitely have solution for such conditions. Once we place the stitch, the pregnancy, usually most of the times it goes up to term, and it will be a cesarean section that will be done at the end of the term, and they will have a baby in their arms. So we plan the stitch in the interval period or during the pregnancy. And of late, it has given so many of these mid-trimester miscarriages patients with baby.
Oh, wow, that's such a big hope.
Yes.
Right. So, like, I think you were talking about minimal invasive, right? So, what does it actually mean when you say that?
Yes. So minimally invasive. You know that, right? If you have heard your grandmother or some aunt undergoing surgeries, they would have had a big cut.
Okay.
2 months of rest,
Yes,
3 months
yes,
of
yes,
rest,
right.
isn't it? So whenever a person is told that they have to undergo surgery, they will imagine 2 months, 3 months of rest.
Yeah,
And
very
that is
true.
what will deter them from going through a surgery many a times.
Correct.
Because they will be facing so many issues at home, they will not be able to go through a surgery.
Yes.
But now what we have is minimally invasive surgery, wherein we do a hysterectomy, the patient is discharged, say the second day or maximum the third day, and many a times it can even be daycare procedure.
Okay.
And the patient will require, say, around 8 days or at the most 10 days of rest. They can be back to most of the normal chores by around 10 days.
So
This is
recovery is
what we call,
fast.
yes, this is
Okay.
what we call minimally invasive surgery. So instead of the big long cuts, what we are doing is tiny holes, 3 holes or 4 holes or even 2 holes. With these small incisions, we are able to do the same big surgeries that were done through bigger holes, bigger incisions earlier. But the best part is the recovery is amazingly quick.
Okay, because I also remember that even earlier, I think the recovery time was like 5-6 months, and then
Yes.
we're not supposed to lift heavy weights, do this and that.
Correct.
But these days, people are hitting gym right after like 10 days, 20
Yes.
days, or a month max.
Yes,
They-
gym, of course, we may say they might require around 1.5 months time at
to
least.
lift weights, but they can do like normal cardio activities
No,
after
no,
that.
no, no.
Not
They
at
will
all?
be able to do only after 1.5 months.
Okay, okay.
But
Huh.
doing small household activities,
Walking,
walking is
brisk
not
walk
at
and
all
all
an
that.
issue. And many of our high-profile, bigger consultants, they start working by 1 week's time.
Oh, that's nice.
And you will not believe, one of our pediatricians who underwent the surgery, the next day, you will not believe, when I went for the rounds, she was already doing her rounds.
Oh,
The
wow.
second day of surgery, she was doing her rounds. It can be as quick. This is
Okay.
minimally invasive surgery. And there are many people who can say, we used to be able to see everything while we were operating. Now I can say that when we are doing the minimal invasive surgery, the magnification is almost 5 times. So a tiny
Okay.
blood vessel, I can see it 5 times bigger. So with laparoscopy or with robotic surgery, the precision is good and we can do precise surgeries.
Doctor, that was so much information to absorb. Okay, so but I think that since we are summarizing this one, can you just talk about any case study in past whether you have seen a patient which has some symptoms, and as you were mentioning, asymptomatic. So if she was not aware for a year or so, and later she got diagnosed with, and like how did you deal with it, and how is the patient doing now?
There is a big subset of these asymptomatic cases.
Okay.
Especially now that women are very active, they go to the gym, they have good tight abdominal walls. There is a tendency to ignore their abdominal wall symptoms. That means a mass that is growing inside the tummy, they may not be able to make out. So we've recently seen a woman who presented to us, young lady.
Okay.
She presented with just a routine, for occupation when they get their routine examinations done,
Correct.
routine health checkups done. It was noted that she has around 15 centimeters fibroid. That's a massive one.
My
The size
God.
of the uterus is around 5 to 6 centimeters.
Yes, yes.
But the fibroid size was 15
Three
centimeters.
times of it.
Exactly. And it was almost up to her mid tummy. So this was the kind of, the big mass that she had. It was totally asymptomatic.
No symptoms at all?
Absolutely no symptoms.
No pain, nothing?
Now, there are certain fibroids which grow outside the uterus,
Okay.
on the surface of the uterus. So even if they grow to 20 centimeters, they'll have no symptoms. But for her, we had to do such a major surgery. It had to be a combined laparoscopy and a small open as well to remove that. So she could have avoided had she been doing regular health checkups. And I can think of one more girl, a very young girl, a 14-year-old. She came, her mom got her saying that she's putting on a lot of weight. For her age, I think she is, in the last 2-3 months, we have seen her putting on almost like 4-5 kgs of weight. And she's studying for her exam. She was due for her exams. And she's just sitting, eating, and she's putting on so much of weight. Just have a look. When I examined her, it was, you will not believe, almost like 9 months pregnant uterus-sized cyst.
Oh my God, that's...
A 14-year-old girl having a huge cyst. Okay, so we waited for her to finish the exams and then we did a surgery. Yes, it was again a minimal invasive surgery. With just 3 holes, we removed that complete cyst.
So apart from that, there was no symptoms, just she was
Absolutely no symptoms.
No
Young girls, they will not know anything and they will be growing very slowly. They will get used to it. Okay. If something is happening all of a sudden, you develop pain, yes, you will know about it. But if the fibroid is growing very slowly over years, cyst is growing very slowly over years, the body will get used to it.
So after those surgery, which you said that very minimal invasive surgery you did, so that doesn't impact her future reproductive health or something?
So we do the surgery in such a way that her ovaries are not affected, her eggs. When I say I'm a fertility-enhancing laparoscopic surgeon, I'll be very, very mindful about even one single egg in the ovary.
Okay.
We try to not even damage one single egg. That means our precision has to be so much.
Correct.
When I do a surgery inside the uterus for a fertility case, I have to be very, very endometrium minded.
Okay.
So a fertility-enhancing surgeon will take care of these factors that they are going to have a child later on.
Later on, yeah, right. Because at that young age, that should not intervene actually in future.
So we have girls who are almost 25 years now who had undergone similar surgeries in the past. It's been almost like 9 years back and they are doing wonderful. Patient being in US, doing her studies. She'll come back now for her studies, for her wedding and next fertility.
So after this surgery, do they have any precautions to take or medications?
Yes. Here again, we are asking them to go through CA-125. When I said cyst, it is CA-125. It's a tumor marker that we ask them to do every year, an abdominopelvic scan and an examination. This they should do religiously without fail.
Lifelong or certain time?
Yes.
Yeah. Lifelong.
Yes. They have to do it at least till they conceive, deliver, until they are menopausal.
Okay. Got it. But yeah,
as long as the ovary matters, we do those examinations. As long as the uterus matters, we do those examinations.
So once you go under invasive surgery, you have to be very mindful and get your scans and tests every year done.
Yes, exactly. So even after hysterectomy, we ask them to come back for follow-up every year.
Doctor, thank you so much for this wonderful conversation and giving so much information on every small or bigger problems which is, impacting women's health these days. And thank you so much again for that. So now we will move to a different section wherein I'll be asking you few, not questions, exactly these are the scenarios wherein you have to either categorize them into normal, common but not normal, or needs evaluation. So I'll give you few scenarios to you. And then you categorize them, okay? So are you ready, doctor?
Yes, absolutely.
Okay. So first scenario is severe cramps causing missed work.
This is common, but it's not normal.
Why?
Needs evaluation.
Why?
That's because cramps are common, but missing work, that means she's having a lot of pain. She's unable to bear it for the whole day.
Correct.
Okay, so it needs evaluation. and it at least needs medications. So you have to visit a gynecologist.
Noted. Scenario 2 is bleeding 8 to 10 days.
Absolutely not normal.
Why would you say that?
2 to 5 days, 2 to 7 days is what is normal. Beyond that, anything is abnormal.
All right. Next one is changing pad every hour.
Not normal.
Okay. Why?
It is not common also, and it is not normal also.
I mean,
So it can suggest that it could be fibroid, it could be a polyp inside the uterus, it could be adenomyosis, it could be endometriosis. It highlights that it can be an abnormal condition.
Okay. All right. Next scenario, pain during intercourse.
Pain depends on whether it is just a functional pain, superficial pain, deep pain. So we normally evaluate this by taking a history and doing an examination.
Okay.
Sometimes in the beginning it can just be a normal one, but even with many years of marriage and intercourse, if it persists, it's not normal. Deep intercourse is not normal. Deep pain is not normal.
All right. Okay. Spotting between cycles?
Not normal. And at times some women have spotting during ovulation. That could be normal, but it needs evaluation, and only then say that this is normal or abnormal.
Noted.
It can also highlight that it could be endometrial cancer or uterine cancer, cervix cancer, if we are seeing this in the elderly age groups.
Okay, so how would you categorize bloating resembling pregnancy?
It depends on which age group they present with. Elderly age groups presenting with bloating, we will think of ovarian cancer, we will think of large fibroids. Okay. First thing what we think is abnormal. We examine. If it is not abnormal, then we are happy to say that it is normal.
Okay, last scenario for you. Pelvic pain outside periods.
Not always normal. It depends at what the days of the cycle they are presenting it with and what activity that they are presenting it with. So we see multiple history. We take history, examine, do an ultrasound scan, and then rule out that it's abnormal. So any pain outside periods, no, it's not normal.
Wonderful. Thank you so much for being so fast and giving so much information on the game. Thank you so much, doctor, for coming here and joining us for the podcast and taking out time for this, podcast specially, and giving so much information to our viewers. I'm very sure that so many women had so many doubts, and I think you have clarified it very well, and providing so much information on keeping gynec health right up to the mark and getting yourself checked. And I think all the awareness which is coming out from you, definitely audience will have some takeaways today. So before we close this, do you have any closing statements, or you would like to say something to our audience so that will be good for them to know, and whatever you like to say, that just
Thank
a
you,
closing
Shruti.
statement.
Thank you. I had a good time too, speaking to you and discussing about all the general topics. What I'm more happy is that I'm able to tell certain conditions, tell certain symptoms which you should be aware of. That is probably red flags in your daily routine symptoms that you face. Be aware of these symptoms, be aware what is normal, and get to meet your gynecologist whenever you feel that it is abnormal. Don't bear them in silence. There is always a gynecologist to help you with your conditions, to diagnose things early, and do, if at all surgeries are required, minimally invasive surgeries are available, and many non-invasive surgeries, non-surgical techniques are also available. So don't be scared of any condition. There is a solution for each and everything. So you start at first by doing a regular health checkup, having a good diet, having a good sleep, exercise, and less stressful job and work and home. Have a great day. Thank you.